yourself?
Oh, sure. My name is Alex. I'm the Director of Health and Human Services.
My name is Richard White.
Susan Chandler?
Fran Mastaro.
Barb Hartford. Thank you.
And our liaison, want to say hello?
Hi, Beth Runyon.
Okay, so I'm calling this meeting to order. Is there anyone who would like to say something for public speak? No? Okay, can we approve the minutes? Motion to approve the minutes?
So moved.
So moved.
Second?
Second? Any comments? Corrections?
Yeah, correct, I'm sorry.
Okay.
Housing prevention came out.
Oh,
It came out a
dear.
little bit, that should be.
Oh, should be
homeless
homeless.
prevention.
Sorry about that.
Okay,
Thank you.
I didn't notice that. All right, with that amendment?
And
Should we
you
approve?
did, so approved.
Okay, all in favor? Aye.
Aye.
All opposed? Okay, thank you. We do have one more application, which is the AIDS Support Group of Cape Cod, which Richard has agreed to lead. But I'd like to adjust the agenda since Alex is going to have to leave. And we do want to kind of get a little clarity on the Navigators Program request. And I had asked Alex whether or not we were, in a sense, required to do their full request for the maintenance of their program. And I guess we don't really know that, but maybe you want to give us some feedback.
Well, I'm sorry. I don't think I understood the question when it came through. However, I will say that the Navigator program that exists, right, I believe it's a third of a position at the police department. I know it's utilized. So, as with any of the other grant requests, this committee can recommend giving the full amount they requested or less. So it's certainly something that you can consider. I would be happy to reach out to Outer Cape to get additional information about how busy they are. The third of the position, because I would say that, you know, this position is completely funded through this grant. So if you do reduce the amount, would it result in less than a third of the position would be my question. I would assume so. If they're asking for additional funding, I would assume it's to cover the entire cost of that position. But what I can say is it's a wonderful resource for this community. We talk about it quite a bit at the health department, giving out, you know, talking to people at the counter about it. So we can find out, though. I'd be happy to email Outer Cape and get some additional information.
Yeah. Right.
I think we need to drill down on, I mean, to be very specific with Outer Cape on the Navigator line, only because this differs from the grant requests that we're getting from the other groups. Even the Outer Cape Health grant request, because we're getting a specific service that is defined, and from where I stand, it looks like they raised their price by $5,000.
Right.
And I think they should be shy about saying this is what this costs for you, for us, for Orleans to use. And then I'd be comfortable to understand, you know, this is what we need to operate 1/3, the way it's currently constructed, this is what we need to operate. And okay, then we'll agree on that. But I would discourage them from approaching this one from a grant standpoint. It's more or less what is the number that makes it work as it's presently defined and constructed. That's the way I.
Okay, and I'll just sort of as the other side of the picture. It was a little bit different from everything else when we started. We didn't really get an application originally. We sort of heard about it and from Fran's work and other people's work and the need we knew. We hadn't really done a whole lot of behavioral health programs. I'm uncomfortable with us being the only funder. It would seem to me that they were funded by the police and then the police stopped their funding and we picked up their funding. They're a part of a $48 million program at the Outer Cape Health. And it seems to me that I don't know that we should feel obligated that if we don't meet their request, somehow or other, it's gonna fall apart, like all the rest of them, because we didn't really ask that question. And
Right.
I guess my overall recommendation, and I think we'll get there, is to kind of not increase anybody, but keep them where they were last year's request, and then be able to have the new programs funding, because we have some additional new programs. If we put all of the money that they're requesting back to them, we're gonna have to cut others more. So I think we need to have that discussion, but I guess we were asking the question of whether or not they'd go under if we didn't give them the extra 5,000, and I kind of doubt it. I think they could reduce their hours, or they could find some other funding, but for us to feel sort of obligated that it's us or nobody, that's not really how we have funded this, or made our recommendations in the past.
I completely agree with that.
Oh, thank you.
I do. Well said.
We haven't really gotten to sort of how we're gonna do this yet, but I mean, I guess I just wanted to know, and that's why I wrote to Alex, whether they are different, and whether or not there could be some opioid dollars or some other dollars. It's such a great program, and they came and gave a fabulous presentation, and we spoke to the crisis intervention person, and I have a social work background, and I thought, this is fabulous. I mean, they're really doing wraparound services, they're doing acute services, I'm sure they're reducing the numbers of people going into ER and the emergencies. And it was very impressive, and I'm a big supporter, but I don't want to feel obligated that this one is fully funded and others who are asking and also are serving Orleans tremendously that are going to get cut because of it. So that's the balance. You had a
Alex,
different
I have a
opinion.
question for you.
Mm.
And if you say absolutely not, that's a perfectly fine answer, just as a, so this is for fiscal year '27.
Mhm.
It's my understanding the town budget hasn't been passed yet for fiscal year '27. Is there any way that you could give us $228,700 instead of, could you give us $28,700 more so that we could fund 28,700 more so that we could fully fund everybody?
Oh,
Can you say the number again? 20?
28,700.
I'll just jump in and just
No.
say, the budget this year is extremely tight.
Mm.
I mean, really down to single dollars almost. And for instance, there's a new position that's going to be created probably for the Council on Aging. And it's going to have to be done as an override. That's, anything that's sort of either wasn't planned for or is new is really going to be an override. And we haven't even, the schools haven't even submitted their budgets yet. So
Oh, wow. So was,
so I think having more in your budget every year is a good thing. I think I don't think there'd be anything, but is it kind of late for this year?
Yes, so you're correct, we have not gone to town meeting yet and had the budget approved, but the work has been done, and, I mean, the line items are kind of set, in my understanding.
okay.
This process begins back in October, November, so the numbers for fiscal year '27 are, on our end, have been set for a while. It is late to go in and make a request like that, and, like Meph said, I think things are it's very planned out already, and I'm not sure there's a lot of wiggle room.
I just thought it was worth asking.
No, it's a great question, just in
so-
case we could have said yes, but I'm not sure.
So we did not get an increase this year from last year,
Mhm.
or I should, next year for this year. So if we want to make an increase for '28,
Mhm.
it sounds like we should get to you really early about that.
Correct,
Okay,
yes.
okay.
Mhm.
Thank you.
October is probably about right.
Yes,
October, okay.
But I think you should ask. I mean,
Right.
I think.
Yeah, we didn't ask this year because we were under budget last year. I
Mhm.
get this in last number, but anyway, the last funding cycle, we were under the 200,000, so we didn't ask for more this year, and then we came
Yeah.
in, what, 15, almost 15% higher this year than we did
Mhm.
last year, so.
I think the expectation that requests for this kind of money are only going to get bigger.
Absolutely,
Mhm.
right.
And we did some active outreach this year, which I was happy about, and we got more agencies. And because we were also under in the number of agencies that had even applied. So we did some outreach, and you did some good outreach, and we got more agencies and more requests. So that's the good thing, even though we can't manage the budget.
Right, right.
Well, and being, you're essentially allocating the entire budget for these requests, and that it come next fall to make the request for an
Right.
increase, that you can prove, how needed this is.
Right.
Certainly, and you can see the progression on Barb's lovely spreadsheet here. You can even see from fiscal year '25 on, it's only gone up,
Right.
the requests, so.
Right.
And
So-
just to chip in, I think another thing that would be worth spending some time on is seeing if you can build a comparison of Orleans to, say, the Lower Cape towns, and what kind of monies they are putting out for human services. And it might not be easy, because they might run their budgets differently and have monies coming out of different places, but it would be a good thing to know,
Yeah,
I think.
actually, the previous chair was very interested in getting a regional meeting together, and we did get a regional meeting. And I don't know whether this is the thing to say publicly, but we are much more generous than every other town. I mean, some of them have $10,000. They really don't do this as a big thing through a committee like this. Now, I don't know whether or not the departments do it, but
Yeah.
we met with the other committee chairs, and we are very generous. We can be more generous, I think, and the need is certainly increasing. But we did meet and have that data, I have that data. So I guess, Fran, do you want Alex to follow up?
Well, I think so. I'm looking through this, and the Outer Cape Health organization ostensibly serves over 1,000 people in Orleans, 1/12 or 1/8 of our population, or something like that. The Navigator program is probably fewer, but with a much greater intensity and urgency.
Right.
And I've heard nothing but good things. I think we all agree that this is a positive program and positive, I think, decision, and we want to maintain it. So I feel among all of these, this one in particular, we need to really understand how they're presenting this to us. Is this a mandatory fee that covers the service that we're getting now, or is it very loosely put together? And I don't feel that good about that, because I don't know. Then if we cut them back to 20 from 25 ask, as we're going to be cutting a lot of other people from their ask, does that set off alarm bells over at Outer Cape Health? That's all. So, no surprise.
I will certainly follow up, and we can find out what would happen if the grant were 20,000 opposed to 25.
Okay, I guess I was sort of hoping that today's meeting, we'd be able to come up with a recommendation. It can be contingent on this, one way or the other, but if we don't know this, we can't really finish our work.
I think it's a contingent
Okay,
decision.
one way or the other.
It's fair, yeah.
Okay. All right, well, so is there anything else that we need Alex for? Unless you want to call them now and come back.
I can see if I can get, if
Okay,
I do
great.
get in touch with them right now, I will come back and let you know.
Because I'm kind of hoping.
If not, I
this
will
is our last
send the
meeting.
committee an email.
Yeah.
Okay?
Great. Okay, thank
All
you.
right, wonderful, thank you.
All right. Thank you. Okay, so we can go back to the agenda, which is to review the final application, which is the AIDS Support Group of Cape Cod. Oh, I was going to mention that they did submit it and didn't get through somehow, and I appreciate the fact that you went and banged on the door and got an application out of them. So again, I don't know how things get lost, but it did, and so we shouldn't, I think, penalize them, because they did actually come in at an earlier date.
December 12th, 2nd.
December? Yeah, I don't know how it got lost, but I appreciate your advocacy.
So it's always a fairly easy lift to get them to submit an application once once they're aware that ours had gone astray.
Yeah.
And,
Well, and maybe we should put in our procedures that on a certain date, if we don't have the ones that have come in before, we write them a note and say, we haven't gotten your application, and make that kind of a piece of our process, because they would then know.
Well, in fairness, Fran Kelly told us that he contacted them twice, and they told him that they had
Yes,
sent
he
him
was
the
calling the wrong
application.
office. Turns out he was calling Hyannis and Mrs. Provincetown. So, unfortunately. Okay, so
we have to have
Richard.
we have to have something that says, not only do you call after a certain amount of time, but make sure you're calling the right place.
Well, yes.
I mean, it's
go
all,
up.
they're all connected, so.
Yes, they should have
If
followed
they,
that.
I mean, it sounds to me like whoever he talked to in Hyannis knew that they had submitted the application and said, and told him twice that
Yes.
they had submitted it, so.
And they did.
And, yeah, I mean, I love that you stopped in, Richard, and, you know, actually asked them and got it kind of like in hand, because, you know, when they say that they submitted it, I think we have to believe they did. I don't think they're gonna say they didn't if they didn't, but obviously, there was a glitch in the system, because the Homeless Prevention Council was the same way,
Yeah.
and I think there might have been some others that, once we called, they either submitted it, or I can't remember what happened, but just looking at the dates of submission, it sounds like there's some glitch here where things aren't getting to the right person. And part of the problem is that people were sending it to the general health department email. And I think this time we've asked that we be specific on our application, send it to Alex with her personal email address.
At the bottom of the application form.
Yes, right, so that at least it will be directed in the right direction as
Mhm.
opposed to just going to
Yeah.
a general department.
Okay, so Richard, want to lead off the discussion?
Yes, let me begin with just a brief description of the background here.
Thank you.
AIDS was officially recognized and reported by the CDC in 1981. It wasn't until 1983 that the HIV virus was identified as the cause. And I'm sure all of us, everybody in this room fits in that category now, can remember the panic, fear, and shame that followed as the disease spread. By the mid-1980s, AIDS had become a global pandemic. There was an extraordinary explosion of cases in the United States between 1984 and 85. And in the early 1990s, it was the leading cause of death for young adults in the U.S.
Really?
Yeah. So it was in this environment that the AIDS Support Group of Cape Cod was founded in 1986. And it was one of the first AIDS organizations of its type in the United States. Its mission is to foster health, independence, and dignity for people living with AIDS and HIV positive and viral hepatitis by providing care, support, and housing. They also work to help reduce the spread of AIDS and other sexually transmitted diseases through prevention, education, and testing services. It's also included free needle exchange programs that actually caused an issue in Harwich because it was free and it went to court and it was decided it was just fine. The AIDS Support Group operates out of its own building in Provincetown, and they have 43 employees. Operating revenues are $7.4 million, with expenses at a similar level. And this is the interesting part of the way they run this. Slightly over 60% of their revenue is from their own 340B contract pharmacy, and 34% from program service fees. I'm assuming that no one is familiar with 340B contract pharmacies. I wasn't until this past week. It's a federal drug pricing program that was set up in 1992. And it requires Big Pharma to provide discounted drugs if there's going to be any Medicare payments involved. These discounts are substantial. It's like 50% or even more. So what happens here is that the AIDS support group Cape Cod has their own contract pharmacy, or covered pharmacy is the way it's described legally. And so they can buy drugs at a steeply discounted level, but create revenue for themselves by selling them at a slightly higher price. So the end result of this is that patients receive drugs at very favorable prices, significant discounts from the market, but it also provides revenues to support what they're doing. Does that make sense?
Yeah, and if they're
Yeah.
you said Medicare, if they're Medicaid, that would be
Oh,
covered.
excuse me, I meant to say
Medicaid?
Medicaid.
Okay.
Yeah, not Medicare, excuse me. So this is a great arrangement. It expands patient access to care and, as I just said, helps entities like the AIDS Support Group generate revenues. Their other programs are extensive. It's a long list. They include comprehensive medical case management, which is a fundamental key part of what they do. There's transportation assistance, housing assistance, access to food and nutrition services, and it's all focused on helping this critical population lead healthy lives. They have facilities in Provincetown, that's where their offices are located. It's a service center, and there is even a 10-unit housing facility there called Foley House. It's been around for 17 years, and 75 men and women have passed through that housing arrangement over the years. They are
Excuse me,
also in Hyannis. Go ahead.
About the housing, is that like temporary housing while they're looking for full-time housing, or is it like detox, or?
I'm going to characterize it as they do. It's transitional housing,
Okay.
but with some flexibility in it. I think, we're aware of a lot of transitional housing situations that turn into kind of longer-term housing situations. But that's been a very successful part of their program. They're in Hyannis, Martha's Vineyard, and Falmouth, where there's a mobile outreach van. The AIDS Support Group of Cape Cod has a 4-star Charity Navigator rating, one of the highest I've ever seen, actually. It's 96%. So this is a well-established, extremely well-run, important healthcare support and facility on Cape Cod, and it's certainly important to our town and everyone else on the Cape. So since they are highly regarded, well-run, and crucially important, I heartily recommend this.
We have to get you a bad program, because you hardly recommend.
This is turning out to be a problem.
I think we're all the same
I
way.
think there are any bad programs. Great. Anybody have any questions?
No.
No, I'd just like to piggyback on what you said. I'm not familiar anymore, other than, their presentation a couple years ago, and but just reading their application, it's like that they made a point of saying with our funds, they want to expand their mobile facility into Orleans, which I think is really nice to hear. And the other thing that you didn't mention, which I think is wonderful, is them supplying Narcan to the general public.
Yes.
Because I think that I've heard personal stories about people who have saved lives because they've had Narcan on hand. It's a huge, huge lifesaver. And the fact that they're doing it, I think is again, one of the very remarkable things that they're doing.
Thank you for mentioning that. If you go onto their website and you do the services tab, it is a long list, including Narcan. And if there is any aspect of supporting this population that they're missing, I can't figure out what it is, because it's that broad, that extensive, and increasingly deep. in terms of what they do.
It also sounds like they're not duplicating other services that are on the Cape. They're reaching out, looking at other resources and utilizing those resources as opposed to trying to duplicate things. I mean, clearly, the residential piece I hadn't heard about, but that sounds like a very niche population that they're dealing with, that probably
It
wouldn't be
is.
served
Yeah.
otherwise.
Yeah.
Well, I think it's, I mean, as the people live longer in the old days, you know, when this first happened, they were assisting people who then were dying. Now, as the clients are living longer, they're meeting more and more of their needs. It's really very nice to watch an organization not go to mission drift, but to sort of stay
Yeah.
focused on that group, but look at their needs, their wraparound needs.
You know, you're right, we don't read of people dying from HIV, AIDS right now.
Right. So it's more of a maintenance, and they need housing and substance
Yeah.
abuse treatment and everything else they're doing.
And, well, there's a continued lifetime use of antivirals
Mhm.
that is part of this. And
Right.
I'm sure that has a lot to do with this specialized contract pharmacy.
Right, right. That's terrific. Okay, any other questions about this one? All right, so let's think about how we want to go about moving forward with our recommendations. I had asked Barb to put together a column that was leaving the requests where they were last year, with everybody at last year, and then adding half of the two new organizations, the Toy Library, sorry, what's it called? Toy Library.
Toy Library.
And the Pleasant Bay boating. So if we do that, do you want to talk us through the numbers?
Oh, 'cause that's different from the one that you just asked me for. Let me see if I have it. Well, I can probably figure it out in my brain. So if we did that, now you're talking about with the 20, all right, the paper you have in front of you, Susan yesterday asked me to decrease the amount that I had on the previous worksheet for the Navigator program, back to the 20,000, so that right now, everybody, Meth, did I give you one of these?
I printed one out.
Oh, good, okay. So that everybody now is being reflected at the amount that they received last year, except for the two new ones where we decided, we were temporarily recommending that we give them half of what they requested. So with that, we are $1,400 under our $200,000 budget. So we are at 198.6.
So one thought would be, if we did that, I'm just thinking theoretically, I don't know what the committee wants to discuss, but if we did that, we have $1,400 left over. Of that, there's sort of two choices. One of them is we can leave $1,400 left over and leave it in case somebody walks through the door in desperation. Or, I think Barb was chatting about, is let's get there. Let's get to 200,000 and give somebody 1,400 more, which could be the Navigators, or somebody. So I think those are the other ways of thinking about this. What we have to do as protocol is we have to go down each item, each agency, and say what our allocation request is. That's what we have to do today, if we're willing to do that, not knowing the final answer on the Navigator. So those are the options, gang. What do you think?
Well,
Fran?
is it okay to talk about any given particular one right now?
Yes?
Okay. Site Law Services, we're cutting back $100 from their request. They had, they're asking 3,200 versus 3,100 last year. I feel that the people in our town who need legal services, there's no cap on that in terms of how many people could suddenly have a housing problem, a health problem, difficulties with disability payments or what have you. And it's like a retainer that we have.
You're
with
looking at
law
the
firm.
wrong one.
And I think that it's a good faith I think it's good faith on our part if we give them 3,200 versus 3,100. We're cutting them back by 100.
So you're talking about South Coast Legal
Legal.
Services?
Yeah, I thought you
Yeah.
said site
Yeah.
services.
Did I say site? Sorry,
Yeah,
I meant
the
South
legal-
Coast.
the legal
South-
services.
Right.
South Coast Counties Legal Services.
Okay,
I believe that, as I say, that there's a lot of leverage in terms of potential services that could come from that organization for people in our town. And it's a small amount, I think, to offer in good faith by meeting their request this year. So that's all.
okay. So if we gave them the additional 100, then we're 1,300 to
Right.
go.
Right.
Breaks my perfect theorizing to do that, but that's the recommendation. Any other recommendations or ways to think about this? So now we have 1,300.
I was also thinking that, I actually had two options in my brain. One was to give the Navigator program the, whatever's left over. Again, a good faith kind of thing, we're doing the best we can.
Mhm.
Of course, if they are requiring the 25,000, then that makes a difference, but assuming that they're not. And then the other was to take whatever amount we had left over and split it between the two new organizations. So, because we substantially cut them from their ask. Everybody else, we're recommending the same amount from last year.
Mhm.
But with the two new programs, we're actually recommending that we give them half of what they're requesting.
Which would take us to 200,000, is that?
Yeah.
Yeah.
Right, yeah.
I don't know, I'd like to kind of talk about Susan's, like Susan and I have two different approaches. I'm like, spend the money, and Susan is, let's leave a little bit in the coffer in case
Yeah.
somebody comes along. And I'm not wedded to my idea. I'd like to know what the two of you think about it.
Go ahead, Dick.
I was actually a little surprised to hear that, we see ourselves as kind of an emergency funder for last-minute people. So I didn't realize that was part of our brief.
I don't think that's part of our charge, I meant to say, I asked the chairs yesterday, and asked two select board persons there, could we get our charge updated? And I'm told it's now May, but Meth is advocating for us. But no, I don't think we do that. It's just that since we now have this rolling application process, which
Yeah.
we've never had before, somebody could submit a grant. It might not even be an emergency one, it might just be a really very good one, and they found out, like I was talking to the foster closet people, and they never did submit. Now, maybe
Yeah.
they would come in and we'd think, wow, it's a terrific program. So the one idea would be to have a little wiggle room left over, but the other is to spend everything, particularly if you're gonna be asking for more, it's not good to have a lot of money in your balance,
Yeah.
right? So I don't think we see ourselves as an emergency so much as maybe a new thing happens.
Yeah. Well, with the rolling application, we're gonna find ourselves here in this position every year, aren't we?
Yes.
So what we decide now might be important in terms of our thinking going forward. I actually just feel more comfortable spending the 200,000.
When do we actually submit an official final number?
Well, this is what's odd about it, because we don't have to go to the select board, we don't have to go to town meeting, we're doing everything through Alex.
Oh,
So in a
that's right.
sense, the 200,000 is in her budget, and
I
she's
see.
asking us to recommend. So we don't really have, it's not till July of next year that we will start giving out the money. So theoretically, we could hold it, although I am now moving towards Barbara's position of maybe we should give it to the navigators, the pieces that's left over, and it's not their whole application, but I certainly was very impressed with the work that they're doing. Again, not feeling obligated that we're the only ones to fund them, and without us, they can't do it. I don't like that.
Yeah, I just feel
Perspective.
uneasy with this Navigator thing. I don't know what they're gonna say when Alex approaches them, because as I say, it wasn't submitted as like an
Right.
invoice.
But I mean, what is anybody gonna do with our money? We don't really know, so it seems
Yeah.
to me that even if they have to cut a couple of hours, they're still gonna provide that service, if it's that effective, as they
Yeah.
say it is, and if it's meeting this need, as they say it is, and if the police are so thrilled about it, as they are, then I think they'll find a way of coming up with a little bit extra. I don't wanna be the only funder, I don't like that idea, and have them in a sense, well, if you don't give us everything, we're gonna close. I mean, that can't be the answer.
Well, I
Yeah.
guess I feel like if they come back to Alex and say, we need the 25,000 to continue the services that we've provided to you in the past year, I feel like we need to do that. And if that's the case, then we have another problem, which is we are going to have to cut some of the other organizations in order to make up that difference between the.
But we're not
25.
asking that question of anybody else.
I thought Alex was just going to ask.
No, she is, but I'm saying anybody, I think people are asking for what they need. And if they don't get it, they're gonna have to adjust their program, as every nonprofit does. So you either don't do a whole day on Thursday, you do a half a day. But any one of these, if we kind of ask that question, I think they're gonna say, we need what we're asked for to fulfill our program
I'm
at
sure
our
they will.
expectation.
Good point.
Yeah.
With respect to your point, there, Barbara, I'm extremely uncomfortable with this idea of just invoicing us. And Fran explained that perfectly. That, it just doesn't sound right. That doesn't need to sound like it should be part of what we're doing here. I mean, it's a public health service they're providing the town, and shouldn't work that way.
I agree. I think Navigator, as vital and as useful and as it is a service that the entire town ordinarily would be deciding to take care of. And like I say, it would be an invoice that they got from Outer Cape Health. Here's what we need to do to give you your 1/3 person and subsequent services. I think we've taken this on, fine, but we've taken it, but it departs a little from our mission, which is these other nonprofits and that have an impact on citizens here. And if you deduct 20,000 from this number, there's quite a bit of funding available for everybody else. So I'm happy where we are right now. I'd like to hear what color we get from Alex, from these people, because we don't know exactly how they're going to respond to our question. And the 1,400 instead of 1,300 may come in handy. We may need to negotiate a little. I don't know. So let's get the information we need, I think, to understand what the Navigator's cost is that we need to fund. And then we can back our way back into everything else, I think. Because we just don't know what they're going to say.
But if you describe it in terms of what we need to fund, it's still sounding like an invoice to me that should be presented to a different part of the health department.
It does to me. It does to me. Now, if somebody else in the health department wants to joint venture this with us, and where we do 10 and they do 10 or something, that's fine, but we need to talk internally. You know, that the police department used to do this, and it came off their budget rather peremptorily, and not with a lot of explanation. And I think it was one of these things, I'm speculating, that as every organization does, they say, okay, what are we doing, and what are things that are sort of outside our purview normally?
That's right.
And this kind of fell in there, even though it was, everybody would raise their hand and say, this is
We spoke to the
a...
chief, and the chief said that this was fabulous, but that he has to weigh it over overtime.
Right.
So, you've got personnel costs, and this isn't in their core mission. As police officers, they're not behavioral health experts. That's why the collaboration was so interesting.
Right, and we came along and we helped out last year,
Yeah.
bearing in mind that every dollar we have comes out of the town budget. It's still,
Right.
it's still a town
Yes.
money,
Yeah.
which, if they reduced our budget by 20,000 and the health department got the 20,
Right.
in a way, it would maybe that's a better way to do it. If money is dear, this is important, what we do is important, it would refocus us on our mission with less resources, and then that thing would be funded, would be taken care of. And everybody would understand going forward, eyes open, what has to be done.
Well, again, history is that we had not been doing behavioral health, and that the need from that community report came, and the select board was encouraging us to sort of expand. That's how we sort of got here in the first place. So this is still our strongest behavioral health grant.
I absolutely
And I think
agree.
that does meet the needs and our charge.
Yes, but I still think that I think we could argue it, and in a way, it's kind of where you're standing and what perspective you're taking, that this is a functional need of the normal workings of our town government. You know, in terms of whether it's fire and police and making sure that the water is in proper shape and things like that. And I think mental health, behavioral health issues, and responding to them properly is kind of an emerging,
Right.
list of practices. So it kind of feels different. But everybody we talk to says, boy, this thing really works,
Right.
and it's really good.
Right.
So just bring back, let's just finish, and I'll just say this. I'm fine with us giving them this money. I don't have a problem.
Which money?
But the 20,000 that we're gonna recommend, okay? I don't have a problem with that. But if they come back and say, no, we can't do this for 20,
Mhm.
then we have to take 5,000 away from these other organizations who have a portion of their effort devoted to Orleans, which is what we want to encourage, that
Yeah.
they're still around to
Okay.
be here for Orleans. And that other 5,000, I don't think should have to come out of them. I think it should come out of, I think we should find a way to say, this is an important focus for Orleans, Orleans Health.
Mhm.
And so some arrangement should be made to make that a permanent source of funds for at least a portion of what they're asking for every year.
Okay.
Do
Yeah,
you see where I'm
okay.
coming from on this?
Okay, so I guess, again, I'm thinking strategically. So this is now March.
Yeah,
We don't have to finish today, although I was sort of hoping it'd be good to kind of just feel like we've got at least a draft of our recommendations.
Yeah.
And that we've gone through them and are at least making the decision about whether we're gonna fund it at total or we're gonna fund it and leave a little extra wiggle room. And I'm now moving towards Barb, going to fund everything, fund it up to 200,000. But, and then wait and hear some kind of feedback from the, from the navigators. The only other things we have left out is that at one point we were gonna do a 990 workshop to kind of just look at how we might improve the way we do our evaluations of agencies. And Richard had offered to kind of help us go
We're
through
happy to
with the
talk about that,
IRS
yeah.
990. So we could have a meeting to do that in a couple of weeks. But I guess I'm a little uncomfortable sort of saying, let's just wait for the navigators. I kind of wanted to sort of go through this and sort of get to at least a draft recommendation.
mhm, okay.
Yeah, I'm kind of extremely uncomfortable for waiting to hear what they say about this, because if they say, well, we're going to have to cut this program back, that means, we're the only people funding it. And for all the reasons previously mentioned, I am really uncomfortable with that. And what happens next year? They say, well, it's actually going to cost more. I mean,
Right.
Stretching this out at perhaps an absurd level, 5 years down the road.
That's our only contract.
Yeah, that's the only thing we're doing,
Right.
and that doesn't make sense at
Right,
all to
right.
me. I think we ought to approve them at this $20,000 level, and couldn't agree more with all the positive comments made about the importance of behavioral health and this very critical nexus between the police department and understanding the real sensitivities that exist here when they're going out on calls and encountering
Right.
families. It's a big deal. But I think we ought to leave it at 20, and we'll be interested to hear what they have to say.
Yeah.
And I hope it's done.
I recommend that as
I'm
well.
fine with that.
Okay, so then we have if we do, and again, it's a draft, we're presenting this in our minutes as sort of our first round of recommendations. So then we have 1,400, or if we're gonna give the legal ones an additional 100, then we have 1,300. So, do we wanna leave that or at the moment, or do we wanna, put it to the new ones? Or to the navigators? I mean, those are still options.
Well, we have some red numbers out here for people, particularly existing people. Maybe we should take a look at, does anybody have strong feelings about any of those, for starters, as to whether we could give them a little more? I don't, anybody needs a little more, we don't know.
I'm a big fan of Food for Kids. I think that is an awesome program, feeding tens of thousands of children over the summer. And, you know, when you consider why this need exists, these children are not in school and are not receiving important nutrition there. You know, we're taking care of kids, we're taking care of working families, we're relieving a lot of concern and worry from those parents. So I love that program.
That's a good one. And then the Family Pantry of Cape Cod, which also is food, has the highest number of people other than Navigators served, is that right?
Well,
On Lower Cape
Navigator is
Outreach.
really with Navigator, when they gave us their handout, the number that's on here was for the full.
We never
full
did get that.
organization. We did in the handout, but I didn't make the correction.
Oh.
It wasn't specific to Orleans, but when she was talking about it, clearly it is not the total amount, the 1042, whatever,
Yeah.
the 1042.
So-
You know, I mean, and my favorite is Lower Cape Outreach. I think that's an organization, not one of my organizations, but I just think that the outreach that they do to the community is huge, and the services they provide. I think we could probably amongst us make a case for every single one of the organizations.
That's right.
that we're not giving the full amount.
You know, we have two brand-new ones,
Right.
and we've said 50%.
Right.
And if we were to take 500 from each, we'd have $1,000 to spend. And I don't have a problem with that. They're new. I recall that the discussion, in the conversation with the Cape Cod Toy Library, they're kind of getting their act together organizationally still. So, not to take anything away from them, but I don't know that that's a make or break number for them, an additional $500. And on Pleasant Bay Community Voting, they're fairly new also, right?
They're brand new.
Yeah. So this is another one where we're getting to know them, they're getting to know us, and so a $500 pairing of that back to two, I don't think is a bad thing. And because we have other people that we know do good things, and we've had to, you know, put them back a little bit.
So then we have 2,300.
Right.
What do we do with it?
Yeah. So it's something.
Well, if we're doing 500 each, that's 1,000, right? So then we have 300. What'd you say?
Yeah, that's what I,
1,300? We
that's
have
what I thought.
1,400 to distribute.
Right, and then another 1,000 would be 2,400?
We're going down.
We're going down.
No, we're taking 500 away from the Pleasant Bay and Cape Cod Toy Library.
You're taking it away from them?
Taking away from.
Oh, I thought you were.
Reducing them by
Oh,
500.
sorry, I thought you were recommending that since they're new, that we go add to them.
No, I'd say.
Okay, you're going the other way,
Let's
right?
cut them back a little bit.
Okay.
And add that into what we would have discretion over.
I see.
I'd like to take the opposite approach, which would be to add the $100 into your recommendation, the South Coast County's Legal Services, which leaves us with $1,300.
Mhm.
Take that $1,300, divide it in half, and give each of the new organizations that $1,300. $650, which would be $3,150. So we go from $2,500 to $3,150.
Well, it boils down to, where do we have a history of positive outcomes versus people who are new, who sound pretty good and earnest and sincere, and we like the concepts, but they're brand new. We don't know whether they're,
Well, I
how
think
key
of
this
the,
is.
of the two of them, the Pleasant Bay, I mean, they've been around longer, much longer, even though they haven't been running that particular program. They've been sort of
Right,
around
yeah.
as a pretty successful nonprofit. Yeah, I mean, I think this is always hard. The other idea is that it's sort of an investment in their future, and that it's a bit, for the toy library, it's a bit of a capacity building, or a little bit of money to help them, and hope they'll come back with a stronger program next year. So I kind of like that idea. I think, again, if we're looking at our favorites, I think Lower Cape is just a fabulous organization, but they also have a fabulous fundraising mechanism. I mean, their galas and everything like that. They don't need our money, I think, quite so much as some of these others. I mean, you sort of have the feeling that, you know, the group like the Toy Library is really on a shoestring, and so if they're going to
Mhm.
succeed, then our money would help a lot. Whereas I think with the
Fair.
Lower Cape Outreach, they could live without us, right?
So how about this? How about if we take Fran's idea of decreasing the funding for the two new to us programs by $500, that's an additional $1,000. We add the $100 back into South Coast Legal, which leaves us additional $1,300, so we have $2,300. How about if we divide the $2,300 between the, now I'm getting lost, Family Pantry and Food for Kids?
Well, that's a theory. I mean, I like that
It
as
is a theory.
I like
That's what I'm
theories.
throwing out.
No, so that's like food.
Idea.
And, you know, and I think food and
Those-
housing.
Weren't those the two that you two picked
Yes,
out? as-
yes.
Yeah,
So that's $1,150 for each of them.
Family Pantry serves 2,775 distinct individuals in Orleans. They have an interim director, by the way. His name is David Simmons. Paul Lonergan has stepped away. It turns
Oh.
out he was not a great fit.
Oh,
But an awesome organization, and the need for, and they focus on nutrition, and the need for nutrition is only growing.
Well, with
I like that.
Family Pantry, they're only asking for $1,000 more. I don't think we should give anybody more than what they're, I don't think we can give anybody more than what they're asking. I think we
Agreed.
found that out before.
Agreed.
So even though if we split it, it's $1,150, we really can only give them $1,000.
So we give them 1,000, and that,
And then give the kids,
then we have, what, 1,300
Right.
to spend somewhere else, of which the next
well, we could give the kids another
item,
1,000.
yeah, exactly.
Yeah, I like that.
Does that get us there?
Okay, so let's get the computer going here.
So that recommendation would be 100 for the South Coast Legal, which doesn't fit my theory, but since Fran wants to do that. And then 1,000 for the pantry, and 1,000 for Food for Kids.
No, we put the extra.
That's where we put the extra.
Okay, hang on just a second.
And then we're leaving the new ones with the cut that we had before. Da-da-da-da-da, we're gonna get a budget of 200,000.
Wait a second here.
Here we go.
Except I think we still have 300, don't we?
Yeah, you still have 300, yeah.
We still have 300. So Barb suggested we go out for lunch.
I'm not sure that's our offsite.
Really? That's not supposed to go on the public
All
record.
right. No, she didn't, I'm kidding.
Yes.
Okay,
Just bear with me, I'm very slow, but I'm,
no, we
No,
appreciate
this
it.
is,
Okay, so let's think of who gets the last 300.
Frankly, if you want to go give 150 back to each of
those two, yes,
To the
I
new
agree.
ones?
organizations we took 500 away from, so we're reducing them by 350.
All right,
Yeah, let's
Or
do
we
that.
reduced our recommendation by 350 is what it winds up to be.
so for Food for Kids, we're saying we'd add $1,000? Okay, so we have, oops.
and now we're adding the final bit to the two new ones. Or cutting them
Oh,
less.
wait, I'm getting very confused now. Okay, so for some reason, I'm over by $700, not under by $300, so I've made a mistake somewhere.
Well, did you reduce Cape Cod Toy Library to 2,000?
Yes.
And also Pleasant Bay Community Boating to 2,000?
Cape Cod Toy Library is 2,000. Pleasant Bay, oh, Pleasant Bay. Okay, so now I'm under 300. So where were you going with the 300?
We're gonna do 150 to
We'll
each of the
give
new
150
ones.
back to those two that
The
we,
two new ones, the toy library.
Ooh.
to the
They
two
get
new
150,
ones. To each of the two new ones, excuse me.
and Pleasant Bay gets back
So
150.
Pleasant Bay would be 2,150?
Yeah,
Mhm. Right.
And toy library.
da-da-da-da-da.
We did it.
We did it? Okay, so now, gang, is that our recommendation, our draft one recommendation pending word from the navigators? And if so, we need to go through each one of them and say out the recommendation till we get to the
Let's do it.
200,000. Are we ready to do that?
Yes.
Okay. Aid Support Group of Cape Cod. Want to read them out?
Okay, 6,000.
6,000.
So do we
Is
need
there
a
a motion?
motion and a,
You know,
for
we're
every single one of these, or
Well,
can we do?
Suzanne's not here.
I know, but we have,
I would
I think
recommend
we-
we make it one big motion.
I
So
think we
read-
need a new motion
Okay.
on how to proceed,
Okay.
and then we proceed. Because the last motion was that we go through each one individually, but we didn't say we, as a motion.
Yes.
So I think it's a little confusing, but it seems to me it's a waste of time for us to move and second and
All
vote
right.
on
I
each
think so,
each
too.
one.
I so
I think that's
move
enough.
that our budget request be one motion, which is every agency's name and allocation.
Second.
Any discussion? You weren't here for the crisis the last time. All right, all in favor?
Aye.
Okay. All right, but we do need to read it out with the
Okay.
amount. Do you want to do
I will
that?
do that, yes.
Okay, thank you.
AIDS Support Group of Cape Cod, 6,000, which is the same as we gave them last year. Do I have to say that every
No.
time?
No, just the
No,
numbers.
just
Okay.
the-
Just the numbers.
Alzheimer's Family Support, 12,000. Big Brothers Big Sisters, 2,000. Capabilities, 6,000. Cape Cod Children's Place, 5,000. Cape Cod Toy Library, 2,150. Duffy Health Center, 2,000. Elder Services, 5,000. Family Pantry of Cape Cod, 11,000. Food for Kids, 5,000. Homeless Prevention Council, 25,000. Housing Assistance Corporation, 10,000. Independence House, 10,600. Lower Cape Outreach, 12,000. Mass Appeal, 1,400. Orleans After School, 30,000. Outer Cape Health, 20,000. Outer Cape Health Navigator Program, 20,000. Pleasant Bay Community Boating, 2,150. Site Loss Services, 2,000. South Coast Counties Legal Services, 3,200. Sustainable Cape, 7,500.
Is there a motion to approve those? Did we already say
We
that?
just want to confirm a total.
Total is 200,000.
200,000. Okay, and I forgot, did we already have a motion before you read it, or do we need a motion to approve them as
We
read?
do not have a motion.
Okay. I so move that we approve those recommendations as draft one of our recommendation list.
Second.
Any discussion? All right, all in favor?
Aye.
All opposed? Ta-da! Thank you, Barb. Thank you, everybody.
Thank you, Barb, for
Okay, I have a couple of announcements. Is there anything else anybody wants to do on this? Okay. A couple of announcements from the chairs meeting yesterday. The Department of Public, not Safety, Resources.
DPW, Public Works.
Works. They have waived the branch fees, so all of us who have branches in our gardens and you have to dump them, you can, there's not gonna be a fee until March 26th. So that's a good thing. My notice is that the Climate Action Roadmap contract has been let by the assistant manager, and we're all looking forward to that. As I mentioned earlier, I raised the question about getting our new charge approved and was told that it's gonna be with all the other committees and their new charges probably in May. So, that's great. Coming up on the new town meeting, there's gonna be the issue of the fire rescue station, the land acquisition and fund construction, capital budgets on the website. If anybody wants to look at it, you actually, under OpenGov, can drill down and look at what the budget was before and anything else. You can't change the numbers, but you can observe them, which sounds kind of fun. The school budget, they're still waiting on the regional numbers to come, and there may have to be an override. Is that right? Yeah. The storm cost, of course, there's lots of extra costs for the town. Hopefully that can be absorbed in their budgets. The water main breaks have been at the sewer line, and that's costing a problem, and hopefully that can be reimbursed. I don't know quite what that actually means, but anyway, that's, I guess, good news. There's an idea that at Kent Point, there will be seasonal stickers so that people during the summer months, the only people who could park there are going to be residents. And there's going to be two hearings on that. That's evidently quite a controversial issue for dog walkers. And so that's happening. The Eldridge
But
Park.
you're just, the sticker will be the Orleans beach sticker. I mean, that's,
It's not a new sticker.
it's not a new
right.
sticker, right?
Right, and I presume there'll be some enforcement?
Yes, the police have already sort of gotten on board with that.
Okay, all right. The Eldridge Park renovation is running under budget, but is pretty much on time. They're gonna have to stop when the baseball games start, but then they get to go again. March 14th is Pie Day, 3.14. Everybody's supposed to have a piece of pie on Pie Day. And that's also the regional high school open house, which is supposed to be phenomenal. If you haven't seen the renovations, you're invited. The Phase 2 sewer connection, which Barb knows lots about, she's in that, is on target.
Phase 1.
Phase
I was in
1? Oh,
Phase
you're
1.
Phase 1?
I
Oh, okay,
was.
well, Phase 2 is evidently on target as of today. It's going to go, connect up.
They were waiting for the approval of the final expenses. Once that's certified, then the clock will start for the hookups,
Right.
which is a
Okay.
year, I believe.
Okay.
Poor people.
The select board is doing a debrief on storm catastrophes, and one of the concerns was why the cell towers took so long to kind of get up and running again. And evidently there were library hotspots that people could go to, but they want to advertise that a little better so people know that they can use their phones, I guess, right?
I didn't know about that. That, I think, is a device that's available from the library for you to take home to your house,
Oh,
which boosts the signal.
which then,
So
I see,
So,
I see.
um,
Okay, so there are like 10 of them or 12
and
of
they're
them.
gonna, I think, look into getting more, but,
Looking at getting more.
but I
Yeah,
think also, I suspect that that's a device that you as an individual could just go out and buy, and I don't think it's
Yeah,
over the
yeah.
A lot of
expensive.
cell phones have a option that you can pay for hotspot,
Right.
and I used mine.
Oh, did it work?
It really did, until they said, well, you ran out.
Oh.
But that was at the very end
Right.
that I ran out of.
Yeah.
Well, and the problem
time.
was the library was closed and nobody could get there anyway,
I
so
know.
even if they had those.
So
Oh, I
we-
thought it was a
we used our
physical
hots-
hotspot,
our
I see.
Phones as hotspots for
Yeah.
the whole thing, for
Right.
everything.
Oh,
You know,
okay,
for-
good to
Took
know.
care of
Do you have Wi-Fi?
video and
Oh.
Wi-Fi and all
Right.
that stuff. So
Good to
I mean,
know.
that created a Wi-Fi signal,
Okay,
so.
so very juicy meeting. Anything I left out?
No,
Pretty much my
covers it
notes?
all.
Okay. Again, we all hope Fran is feeling better soon, and thank you, Barb, for getting a card. We'll send off a card. And I don't think we have any other business.
One thing to mention,
Yes.
I'm going to be out of town until April 9th. Are you anticipating another meeting? And I'm concerned about that with respect to Fran possibly not being available.
Yes.
That leaves you with a quorum, I believe.
3 is a quorum.
3 is
Okay.
quorum, but I don't think we need to have a meeting. Again, if we're gonna wiggle within these numbers, I don't think Alex needs to know that
Yeah.
yet. I don't think we're under a deadline.
I'll be away until roughly that time also,
Okay,
So-
so I guess,
just so you know.
so
So
probably.
no
we-
meeting on the 26th.
So let's not have a meeting on the 26th. And do we want to do the 990 on the, that would be the 9th? Are you back on April 9th?
Well, flying back that day.
Oh, okay, that's not
I mean,
good
You can
then.
get here.
I would not have a problem waiting until our first meeting next year to talk about the 990, where
Oh, okay.
we're getting ready to look at applications
Okay.
and it's fresh in our minds, so if you
Yeah,
want
that's
to
fine with
wait.
me.
Okay. So I think, why don't we leave this then, this be our last meeting, until, or unless we get some alarming information from Alex, this would be our recommendation. And she said she'd email me after she contacts them, and I'll email all of you.
Well, it's
And-
kind of, we sort of have an open field after the 9th.
Yeah,
At least for Dick and I, being
Okay.
available.
okay,
So shall we-
So if we need to schedule something, we could do it on short notice, relatively
Okay.
short notice.
because the next one would be the April 21st, right? Are we scheduled then? No, I don't have that. Oh, it's Thursday,
23rd.
sorry, 23rd.
Right. Shall we just keep that one on the books? Just-
Want to keep April 23rd, reserve the room, but cancel the earlier ones?
Yes.
Do you do
Sounds
that?
good.
Yeah.
Okay.
Yes, I do that. So
Okay.
we don't both do it.
Okay,
So I'll cancel the 2 and then we'll keep the 1, I'll keep them forward from the 23rd until we meet on the 23rd and decide that's our last meeting.
Okay.
That way we don't have to
Okay.
schedule, unschedule and all that.
okay, that's good.
Okay.
Any other
So-
announcements, or?
No.
I just want, I'm not sure I'm revisiting something or not, but if Alex comes back to us and says, Navigator is requiring 25,000, are we
Or-
saying no? Or are we going back to the drawing boards on the 23rd and trying to find $5,000 from the other organizations?
Let's not make it a no now, let's get together and talk about
Okay.
it.
So whatever Alex says to you, we'll talk about on the 23rd if we have to.
Yes.
Okay.
I'm hoping she's not asking the question that way. I don't know why she didn't quite understand my question, but I'm asking, what happens if we give them 20? Like everybody else, how are they gonna manage with
Well, I
us
think
having
we'll
a
find
slate?
out real fast if that was a hard, number.
I don't think they're gonna not.
It's not going to be a.
We're gonna get feedback,
Right.
right?
Yeah.
So
Okay.
then we'll deal with it.
Right, so I will send you the email if she doesn't send it to everybody, or talk with her if I don't understand it, and keep you informed. But other than that, I think we have a great draft recommendation, and thank you all for your fabulous work. Everybody was terrific. Any comments from our
No,
liaison?
congratulations, I think
Good group, eh?
you did a good job, yeah.
Thank you.
Meth, what do you think about that reasoning? I'm opening
Well,
this up.
to me,
About this
my
navigating thing.
experience with nonprofits is you ask and you take what you get.
Yeah.
And I've never heard of any organization saying, well, if you don't give it all to us, we're gonna go home and take the ball with us.
Yeah, I think their reply to us is probably gonna be very important in terms of understanding how they're arriving at whatever we wanna call the $20,000 ask, the $25,000 ask that they have.
Right.
We'll take the $5,000 away from the Outer Cape and give it to the navigator.
Oh, there we go.
Actually, that's what the other
That thought
request.
occurred to me. I'm
That's
sorry.
I don't think they're gonna stop their health program.
Actually, that's an interesting idea.
Thought something
Right.
about it, how it was sound.
Yeah.
Take it away from them.
Oh, yeah.
They're-
Well, again, they're their mother organization, not us.
Yeah.
So, I mean, that-
Definitely something to consider.
I think that's a very
if we get-
clever idea.
If we get the answer. Did we have a motion to adjourn?
no, we did not. Let's have a
I move we
motion to
adjourn the meeting.
Second.
All in favor?
Aye.